Hey everyone, Mike Worrell here. Today we're going to talk about how to get a Medicare Part D prescription drug plan. Stay tuned, I'm going to walk you through it. Medicare Part D prescription drug coverage. First, I want to say if you're a client of mine or you're thinking of working with me when it comes to your Medicare supplement, Medigap, I walk all my clients through this on a one-on-one basis, and I'd be happy to do it with you as well. Um, but in any case, I will show you how to do it yourself if you'd like to. Uh, Medicare prescription drug coverage, very complicated aspect of Medicare. There's a lot of moving parts to it, and it's not something that I sell personally, although I am happy to help you. And most agents aren't going to be working with prescription drug plans, and I would definitely not work with someone who does sell prescription drug plans just because there's way too many of them for one single agent to be able to offer all of them. And Medicare is paying the majority of the premium anyway, so every plan that's available to you, you can find right on Medicare's website. And that's what I'm going to walk you through today. Prescription drug coverage is something that is unique to each person's particular needs. Finding the best plan is going to be contingent on what prescriptions you're particularly taking, and that can be adjusted every single year. And what I'm going to go through in this video is how to do it on a computer. If you are not comfortable using a computer, that is totally fine. Basically, what you want to do if you're not comfortable using a computer is make a list of the prescription drugs you're taking. Write down the list right on a piece of paper and use the names right on your prescription bottle. It's very important that you use the names right off the bottle, because if you write down the generic and you're taking the brand or vice versa, it will heavily skew your results. So make a list of your prescriptions, write down the dose. So for example, 20 milligrams, and how often you take it. Once a day, twice a day, once a week. So you should have a list of prescription drugs that say something along the lines of lisinopril, 20 milligrams once a day. Once you have that list, then you want to call Medicare. You just call 1-800-Medicare. And then a representative from Medicare will actually ask you for that list. You'll provide it to them, and they'll show you what the most cost-effective prescription drug plan for you is going forward. Now, a trick I want to show you as far as calling Medicare is, a lot of people don't know Medicare is 24 hours a day, 365 days a year. So in order to save yourself a long wait as far as getting someone on the phone, I strongly recommend calling them very late at night or very early in the morning. If you can, try and call them after 10 p.m. at night or before 7 o'clock in the morning. Make yourself some tea or something like that. Sit down, be ready for a decently long phone call. Doing it when you call Medicare is probably going to take you 30 minutes to an hour. But calling them at night or very early in the morning will save you a lot of time being on hold. Now, if you are comfortable with the computer, I'm going to show you how to go through those processes right now and how to find the best prescription drug plan for you on Medicare's website as far as cost effectiveness goes.
Alright, so here we are on Medicare's website. You can just go to www.medicare.gov, and once you get here, what you want to do is click this green button on the left here. It says Find Health and Drug Plans. So we're going to click that, and then here we just want to put in our zip code. So I'm just going to pick a random zip code in Texas. Um, 75001, and then we're going to hit find plans. So this page is where you pick whether or not you get extra help. So what kind of Medicare coverage do you have? So if you have original Medicare and a supplement, you can pick original Medicare. If you have health plans, this is an HMO, these are Medicare Advantage plans. So or if you don't have any coverage yet, or you don't know what you have, those are options as well. For this, I'm just going to pick original Medicare. Most of my clients have supplements, so that's what they would pick. And then down here is if you get extra help from the government. So if you have Medicaid, supplemental security income, Medicare savings program, extra help to Social Security. So most people are going to be hitting, I don't get any extra help. So original Medicare, I don't get any extra help. Then we want to continue to plan results. So here is where you can enter in your drugs. And I've said this before, but it's really important you use the drugs right on your prescription bottles. So the drugs that you're taking, the reason that I say it needs to be right on your prescription bottles is because if you give this engine a brand name drug and you're taking a generic, or you give it a generic and you're taking a brand name, it'll heavily skew your results as far as what is recommended. So we don't have to put any drugs in here. If you're not taking any drugs, you can hit this button right up here. It says I don't want to add drugs now. Um, I'm just going to pick a couple of common generic drugs. So let's go hydrochlorothiazide. Um, and 25 milligrams quantity is 30 a month, and they fill them every single month. So you'll fill this out for every single prescription you put in. The dosage that you take, the frequency, which is the quantity that you're filling every month, and then the frequency, which is once a month. Most people are going to be, once a month. Um, and you can pick whether you get this from a retail pharmacy or mail order pharmacy. So hydrochlorothiazide, and let's pick another one. Let's go with metformin. And this is just completely, for example, I'm just picking random medications that are generics. So we'll say this person takes metformin, 500 milligrams, and twice a day. So they fill 60 of them a month, every month. Okay, so we have our drugs, our random drugs that we've put in. Once your drug list is complete, you want to come down here and pick My Drug List is Complete. Now we have the pharmacy page. Um, this is where you can pick the pharmacies that you like to use. If you don't see the pharmacy that you like to use, make sure you go right here and expand the miles, because the zip code is a pretty generic area. You might live on the far edge of the zip code or vice versa, so it may not show the pharmacy you like to go to right away. The pharmacies are listed in alphabetical order, so if you're looking for like Rite Aid or Walmart, you're probably going to want to go to the end here, um, something like that. We see we've got Walmart right here, and CVS. We'll pick Walmart and CVS. You can only pick two at a time. That's all it'll let you pick. So now we're going to hit continue to plan results. You can hit the button here or the button down here. Doesn't matter. So we hit the continue to plan results. Now here's where you want to be careful. You want to hit this one right here, prescription drug coverage. You're not going to want to hit this one, the Medicare health plans with drug coverage, and you're not going to want to hit Medicare health plans without drug coverage. These are Medicare Advantage plans. They replace from Medicare A and B. So you do not want to select these because it'll show you those results. So for just Medicare prescription drug coverage Part D, we're just going to check this top one right here. And then we're going to hit continue to plan results. Okay, so here we are. We want to scroll down to the plans, um, and it's going to show you the lowest cost plan for you right here on the left. So it's showing for us that the lowest cost plan, based on the prescriptions that we put in, Aetna Medicare RX Select has the lowest cost for the rest of the year at $167. And now this number that is listed right here is the most important number that you're looking for, because this number is your estimation for every dollar you'll spend on prescription drug coverage factored out for the rest of the year. So it includes your monthly premium. It includes all cost sharing and copays based on your current prescriptions factored into this one number. Um, So this is the number that you're looking for. So $167. The next one is Humana Walmart at $224. And if you notice right here in this little drop down box, you see lowest remainder of the year retail costs. Um, so one other thing that's important to check is the mail order cost, because oftentimes mail order is less expensive. So we go here and change this to mail order costs, this little drop down box right here. Change it to lowest remainder of the year, mail order cost. And then we hit sort. And then as you can see, the Humana Walmart plan pops up, and it is $204 a year for mail order. And as you can see, the lowest cost mail order is $204 with Humana, and then if you go back, it was showing $164 with Aetna, or $167 with Aetna for retail. Aetna does not have the option for mail order, it looks like, so if it's worth it to you to spend 30 extra bucks a year, you can get your prescription drugs mailed to you in 90-day supplies from Humana. And that's just using the prescriptions I put in. That's not going to be your particular case without you checking this yourself with your particular prescriptions. I'm just showing you based on this example. Um, so whichever one of those you prefer, retail or mail order, they're almost the same price. Um, Now, as far as digging into and getting into the real complicated aspects of these plans, if you're just taking generics, it's usually not a big deal. You know, when you've got low costs like this, you know, $150, $200 a year for your prescriptions. But if you're on an expensive brand name drugs, it's important to do a little bit more investigating. Um, if you're getting prescription drug costs that are $500, $1,000, $2,000, $3,000 a year, you're going to want to do a little bit more investigating. First thing that you're going to want to do is click on the plan. And you're going to want to scroll down here and see if the plan that you picked, oops, you want to go down to drug information. So the first page would be drug costs and coverage. And you scroll down to the bottom here and you want to see if the drugs you're taking require prior authorization or if they have quantity limits. So it may say that your drug is covered, but it may have quantity limits, and that means that the prescription drug plan is only willing to cover a certain amount of a particular prescription, and you want to make sure that you're not prescribed more than that, because if you are, this is probably not going to be the best plan for you. Now, this is very rare that this happens, and this is once again for people who are taking expensive brand name drugs. You do want to check this. Prior authorization is going to mean that your doctor is going to need to write up why you need to be taking this prescription. You know, maybe tell the plan that you've already tried generics and the brand name's the only one that works for you, something along those lines. Um, and something else you can do is you can come down here and see the breakdown of what you're going to be spending every month. So it looks like we're going to be paying our premium every month, which is $16.70 a month. And then we'd pay $12.90 to fill our prescription. And because our prescriptions have such a low cost, they're just going to go towards the deductible for the rest of the year because we're taking a $2 a month prescription and a $15 a month prescription. Um, so very low cost there. And you can see what it costs per pharmacy too. So CVS versus Walmart. Um, Looks like CVS would cost 167 a year and Walmart would cost 296. So with the pharmacies we selected, CVS would definitely be the one that you want to go with. Um, and one other thing you can do too is that this is also for people who are taking really expensive prescriptions. Is you can play with the pharmacies. You know, see what pharmacies are going to have the lowest out of pocket for you. You can also find out the network pharmacies for each plan by going here, 6 network pharmacies. Um, and you can see which ones are preferred. So you can see Walmart is not a preferred, CVS is, Kroger is, Pharmacare isn't, MetroCare isn't, um, and then Tom Thumb Pharmacy. Um, and so you can see by looking here at what you'll pay for each pharmacy. Since Walmart is not a preferred pharmacy, it's almost twice the cost. Whereas if you go to CVS, it's 167. So that's something important to take a look at regardless. Is to just click on, we'll go back here really quick just to show you, but we want to click on the plan and then come down here and see which pharmacies are going to be the most cost effective. Now, if you want to play with the different pharmacies, if there's more pharmacies you're willing to go to, you can come up here and you can see all these results right here. Let's click on select your pharmacies. So we can go back to pharmacies here and we can say we don't want to go to Walmart anymore. We don't want to go to CVS and we want to check out some other ones. Let's check out Kroger. Let's pick another more popular one. Change it to within 3 miles. CVS, Walgreens. Oh yeah, let's try Walgreens. So we've got Kroger and Walgreens now. Let's go back over here to continue to plan results. We've got prescription drug coverage selected. Um, okay. So as you can see, Aetna is still showing up for the lowest cost for retail, but we want to click on the plan and make sure what pharmacies we can go to. So Walgreens is clearly not a preferred pharmacy. Wow, it's going to cost us almost $600 a year to go to Walgreens with this plan. But if we go to Kroger, it's 167. So what we've learned so far is going to Kroger or CVS is going to cost us 167. If we go to Walmart or Walgreens, it's going to cost considerably more. So let's head back here to the prescription drug page. So let's say you've done your research, you figured out that you want to go with Aetna. You've decided that you want to use retail and you want to go to either CVS. You want to go to CVS pharmacy, um, and you hit the enroll button, and you can just fill out the application right here. Um, This application can only be filled out under certain circumstances. So if it's not annual election period, which means it's not October 15th to December 7th every year, then you need to have what's called a special election period. And this is a huge list of special election periods. It's going to be you're just starting Medicare, you're dropping your employer coverage and switching over to Medicare A and B. Um, and so if you try to do a prescription drug plan enrollment outside of annual election period, you're going to need to select what special election period you have that allows you to enroll outside of the normal enrollment period. And that's the first thing that asks you to pick. I'm just going to pick I'm new to Medicare. People turning 65, and then you can just fill this out. It's really easy and simple, and it goes right here straight over to Medicare, and then they send you your policy and cards in the mail. Oh yes, and what I was mentioning before is that Aetna, you'd want to go to either CVS or Kroger, from what we've learned so far, because Walgreens and Walmart are uh, not preferred pharmacies, and it's going to cost a lot more. And once again, you can avoid all of the going to pharmacies by just using mail order, which in this case, the cost is so little difference. It's like $30 a year difference. You can sign up for Humana and have all your prescriptions mailed to you in 90-day supplies, and you don't have to bother going to the pharmacy at all, which a lot of people like taking advantage of that. But you do need to check the cost between retail and mail order. I know this is really complex and it's probably quite a bit overwhelming, but once again, I want to let you know that I am an independent agent. I'm willing to help you with this. If you're having problems or you have questions, I'll be more than happy to walk you through how to do this on a one-on-one basis. All my clients have Medicare supplements with me. I'm more than happy to help with this. Um, please feel free to give me a call, send me an email. I'm always glad to help. And thanks so much for watching my video. I hope it was informative and hopefully it was easy enough to follow. I know it's a little bit complex. Um, Once again, thanks for watching.